From the Carl Chevrolet Studios in West Des Moines, welcome to Iowa Live. I am Lou. The start of a new week. Well, maybe the start of a new week can be the start of eliminating some pain that you have that you've been dealing with for quite some time, and that's the reason we have Dr. Ole Olson joining us right now from Central Iowa Neuropathy. Dr. Olson, how are you, sir?
Hey, I'm doing great, Lou. Thanks for having me on.
Absolutely. Thank you for being here. First, let's start off with telling everybody and explain to everybody what peripheral neuropathy is.
Yeah, so peripheral neuropathy is literally just damage to the nerves outside of our central nervous system. The central nervous system consists of our brain and our spinal cord. And then once those nerves leave the spinal cord and they go down into your arms and your hands, down into your legs or your feet, or even into your organs, those are called peripheral nerves. So any damage to those nerves would be considered peripheral neuropathy.
All right, and now what is the most common causes of peripheral neuropathy?
Yeah, that's a great question, Lou. The most common causes of neuropathy, number one, is diabetic neuropathy by far. The second type is from chemotherapy or radiation due to cancer treatments. The third type is what's called idiopathic, which really is just a fancy word for we don't really know. We've got about 100 different things in there that we believe could be the cause, but it's really unknown. But when it comes down to it, I see one primary cause in nearly 100% of the cases that I see, and it's a circulation issue. If you think of my hand like a nerve cell, these fingers are the blood vessels coming into that nerve cell. So they're bringing in the oxygen, the nutrients, all the nourishment that that nerve cell needs to thrive. Well, what happens is our blood vessels start to shrink. And as those blood vessels shrink, we start to get less and less oxygen, less and less nutrients into that nerve cell, which in time will start to die off and eventually kill that nerve cell. And so this is the point, and actually where most people start to experience symptoms. Whether it's pain, whether it's numbness, tingling, burning, freezing, balance issues, but it's at this later stage when they actually start to experience symptoms. And so when they come to us, the nerve cells died off. So one of the main focuses of our program is restoring circulation. We start to drive blood vessels, or drive blood flow down into those nerve endings, and we start to restore and heal those blood vessels. As that happens, those blood vessels start to open back up, and now all of a sudden we're getting blood flow, we're getting oxygen and nutrients, and now that nerve cell can actually revitalize.
It almost looks, Dr. Olson, like the cell has shut down, and that's the reason you're experiencing all those strange sensations. But you're actually revitalizing it. You're bringing it back from the condition that it was in.
Yeah, absolutely, and that's why so many people are told that they just have to live with this. There's nothing that can be done because there is no medication or surgery that will fix this problem. You have to get down to the physiological aspect of what's actually causing this problem.
Okay, and what can be done to help do what you just got done talking about?
Yeah, so there's lots of different therapies. We use a combination of in-office and at-home therapies to really help these people to recover from this, because it's a very devastating disease. It can affect people in all sorts of ways. So we use a combination of things to restore the blood flow and get them healing. Typically, I would say most patients that we see will start to notice some changes even in the first 4 to 6 weeks. Because this is a very severe disease that we're dealing with. So it does take some time, but we do tend to see things pretty rapidly start to turn around.
Yeah, but the key is you need to seek treatment and get the treatment started before it gets to a condition where it can't go the other direction. But you have some informational seminars and a chance to get a copy of your book as well coming up. Tell everybody how they can take part in that.
Absolutely, yeah. We've got a free seminar coming up to teach people more about peripheral neuropathy, what's going on, what can be done about it. Right now, if you call into the office, you can sign up for one of our time slots. It's very limited because we've got a lot of people that are looking to get help for this. So call right away. When you come in, we actually have a copy of my book for free. It's called Reversing Neuropathy, and that will give you a little bit more background on some of the things we're doing and why we're doing them. So that way you have a better understanding of what we can do to help.
There you go, centraliowaneuropathy.com, or again, 515-505-3700. You see the number there up on the screen, up on the left-hand side here, 515-505-3700. Need to be one of the first 15 callers to take advantage of that and save a spot inside the seminar. It opens up a lot of eyes, doesn't it, Doctor?
Oh, yeah, for sure.
Absolutely. Well, listen, you take care of yourself. Thank you so much for the information. And on behalf of all the people that will be treated at your place here in the very near future, thank you for helping to eliminate their neuropathy pain. It's something that they may have been told can't be done, but they can do it. Thank you, sir.
Absolutely.
All
Thanks,
right.
Lou. Have a great day.